Hello everyone, Dr. Matt Ed. Today we'll talk about acute stent thrombosis, a very important topic. The definition of acute stent thrombosis is the formation of thrombus within a coronary stent resulting in partial or complete vessel occlusion occurring within 24 hours after stent implantation. It causes sudden acute coronary syndrome. When you get an EKG, you see ST elevations, and patient can go into sudden cardiac death or cardiac arrest. Major causes of this are biological, patient-related factors, mechanical, and pharmacologic. With regards to biological, patient-related factors, we think about hypercoagulable states if patients have an inherited thrombophilia, acquired conditions such as cancer or antiphospholipid syndromes. Patients with diabetes are associated with increased platelet activation. Patients with renal failure, particularly those on hemodialysis, have increased thrombotic states. Acute coronary syndrome itself is a prothrombotic state as well. Non-compliance or resistance to antiplatelet therapy. Premature discontinuation of dual antiplatelet therapy. Also clopidogrel resistant or inadequate platelet inhibition. With regards to mechanical causes, this includes stent underexpansion or malapposition. Poor apposition of stent struts to the vessel wall leads to turbulent flow and can result in clot formation. Edge dissection, small tears at the edge of the stent can lead to thrombosis. Residual plaque stenosis or plaque protrusion. Incomplete lesion coverage causing from inadequate stent deployment. Also, using overlapping stents can increase risk due to altered flow dynamics and delayed or inadequate antithrombotic administration during PCI. This includes suboptimal dosing of heparin, GP2B3A inhibitors, etc. With regards to pharmacologic, patients can have inadequate dual antiplatelet therapy or suboptimal heparin dosing, as we mentioned before. They're either not started, incorrectly dosed, or discontinued too early. Patients themselves can have resistance to antiplatelet agents, including genetic polymorphisms, such as the CYP2C19 with clopidogrel, and also drug interactions, especially PPIs with clopidogrel. Management-wise, PCI is the preferred and guideline-recommended treatment for acute stent thrombosis, as it provides superior outcomes compared to fibrinolytic therapy. In situations where PCI is not immediately available, fibrinolytic therapy such as TPA can be considered as a temporary measure, but this approach is based on limited evidence and is not standard of care. Thank you for watching. If you thought this video was helpful, please like, subscribe, and watch out for my next video.